right, so we're here at Rowe Dental Laboratory and we are with Dr. Beenish Orr. What made you kind of decide to go with CHROME? How'd you hear about it, and then what made you go with CHROME?
So basically I was referred by my mentor doctor, who's also part of AIE, and when we started placing Megagen and started any Ridge, he referred me to CHROME. I was using other labs with the plastic guides, but they sometimes break, the accuracy is not that great, the visibility is not there, the angulation of the implants when you're drilling in the mouth is not there. So with the CHROME, it's a floating guide. So it's supported by, and it's a stable guide, it's metal. So obviously it's very, very stable. It's not shaking. If you get good pin guide, if you know how to put the pins right, the guide does not move. And the accuracy and the precision of the procedure in stackable surgeries is so important that with all the other plastic guides that I've used a lot, you get the best with the CHROME. So that's why I decided to stay with CHROME.
Awesome. And what about the C2F technology, the small hole? What do you think about that?
I think that's wonderful, because anytime you're giving a device to a patient, if your angulations are not right, working inside the mouth versus taking that device and working outside the mouth becomes more precise again. So you're not opening up those holes for the cylinders when you're seating your bridge or temporary PMMA or prosthesis, which if you open them more and if there is slight angulation issues, the device is not as predictably solid. So sometimes with the chewing, no matter what you tell your patients, sometimes they chew, sometimes these things break. Some patients have to be in the provisionals for at least 3 to 4 months, depending on the dog, maybe 5 to 6 months. We are burying the implants, some implants we have to bury. So these devices are kind of long-term provisionals. So if you make smaller holes and make the device more solid, it won't break on you, less stress, less tension for the patient, less tension for you, less work in the mouth, more accurate placement. So I love it.
Awesome.
I definitely do.
Awesome. Well, good to hear, and thank you so much for coming in, making the trip, and we appreciate working with you and look forward to many more cases.
Thank you.